Bon dia, good morning. I hope you're doing very well today. So I'm going to tell you a little bit about myself, about a real-life case story, and about a research that we did on eHealthcare. I did a research together with CapGemini Consulting and the Rand Corporation in 2009 on electronic healthcare. We researched best practices. We tried to identify new business models and new innovations. The research that we did in 2009 was about eHealthcare within 4 different areas that the European Commission at that time, so to say, identified. So what you see happening within or going from traditional to new healthcare is primarily that you go from one thing which is professionally centered to something which is patient-centered. And that is really a mind shift and a change. But also going from effectiveness and efficiency to value, from opinion from a clinician to evidence-based, to data gathering. It is not primarily more or less about an organization which is going to give healthcare or advice, but it is about a network who is creating evidence and data and giving that back to the patients or the people that really need it. So, zooming into diabetes care then, nowadays you have the hospitals which provide a solution in diabetes. But where you want to go to is a kind of home care remote system with the hospitals adding value, especially in the handling of diabetes. So what you actually see happening is that in the current situation, you have the hospital as the center of giving care, giving help to everyone. So what will happen when you shift from traditional healthcare to new healthcare? You will get a specific monitoring relationship between the nurse or the clinician and the patient. So the nurse or clinician is more focused on monitoring what is happening with the data which is coming in and can act upon all the fluctuations that are happening at that moment. So the challenges at this moment within the European Union are in acquiring operational budget and funds. You have lots of complex and international legislation, and you have a lack of understanding and interest of healthcare delivery staff and patients. So what were the practical actions we gave the European Commission at that time? Focus on research, build up on the evidence to prove the real success of that eHealthcare system. Use several phases to implement the system. Do it not all at once, but try to focus and try to make it a step-by-step approach. Really dare to use new and innovative business models. Muito obrigado.
I have 2 jobs. One is I'm the director of eHealth and Health 2.0 at Hospital San Juan de Dios, which is it's the largest children's hospital in Spain. And I'm also responsible, the head of academics of an initiative called Moevio in Biocat, which is about bringing the biodesign program from Stanford to Barcelona. Okay? So my work works at the intersection of what I call HEIT, which is healthcare, innovation, technology, and entrepreneurship. And I'd like to share with you some of the things, and especially the project that we've been running for the last 3.5 years that we call the Liquid Hospital, right? Liquid Hospital is a word name. It stands from H from hospital and 2.0 from the 2.0 tools that were very famous when we started the project, right? And nowadays, we thought that the metaphor of liquid, which is something transparent, which is something that flows, which is something that goes to places, was a very, very nice metaphor to try to explain what we're trying to do, which is use technologies, what we call digital healthcare, to provide content and services outside of the building blocks of the hospital. Okay? Patients come to the hospital and they spend time at the hospital probably less than 0.1% of their time, and healthcare happens outside of the hospital, right? And we have to take that into account. So let me explain a little bit about us. We are a children's and maternity care hospital. We are a teaching hospital associated with the University of Barcelona. We are a non-profit private organization. With traditional hospitals, they only had one mission, which was cure and care, right? In the last 10 to 20 years, we've been adding different missions, right? First, it was research and teaching, right? Lately, innovation and health promotion. For example, we have a department of innovation where I'm part of. We have more than 40 products in our pipeline, right? From life sciences, medical devices, organizational processes, etc. So that's important. Also, health promotion. Traditionally, this has been done by governments, but whenever a government says something, it doesn't have the same strength as a leading hospital saying the same thing. So there is something called reference about that. And then the way we treat care is still at the center, but the way we treat it is we are a proximity hospital, we are a reference hospital, but we also do a lot of online, virtual attention, right? And this is what I'm trying to explain to you a little bit today. What we are using the social media is to provide the families with content that is important for them. Individuals have to become the CEOs of their own health. We've been saying that for a lot of time, making people more co-responsible of their health, but this is not something just say it and then it's done. We have to make sure that we help them. And the way we do that is through information. We pass them information that is relevant to them, that is important, and we're expecting that they change their behaviors when they read our things, right? Third thing is special content. We go to the patient. We go to the services and we tell them, okay, patients get to you and they tell you that they're not going to follow your prescription because they've read something in the internet, right? They say yes, a lot, right? So, if you can tell them what to look at, what would you tell me to look at? Okay, so we get here documents, we get here web pages, we get here mobile applications, right? We get here online communities. We put them in here so they can access to that. So we prescribe links, information, etc. So we channel their interest through the things that we think that are important, right? We're also entering the mobile applications, the apps, right? This is one of the apps we have, iPediatric. It's in different languages. It's also in Portuguese, I believe. Online communities, we have 3+1, okay? We have one general, which we call Pharos. Pharos is our web page for promoting healthy habits. That's what we do, and I'll be explaining that in a second. Whenever something we believe that is important, it has some structure, we create another web page, and we call it guides, guías, okay? So we have here Guía Metabólica and Guía Diabetes. So we do it in around diseases, around conditions, right? And then Aptic is a web page where we participate from a university, right? But mainly it is about rare diseases and chronic conditions, right? Even for adults. So this is a little bit of what we do. As you can see, we do too many things, but if there is one common thing is we use technologies to provide services and content that is good for the patients, all right? We can separate space and time. Patients can do things online. They can do things by themselves if we help them, if we target them, if we channel them, and that's very important to get the results that we want. And if we want to make healthcare sustainable, we really have to start thinking on, in our processes, where can we incorporate technology that allows us to do certain things that we cannot do, and where can we make our patients do certain things that we cannot do. And this is the 5 next years are going to be about that. Okay? How can we incorporate the patient, which is the most underused resource in healthcare, and how can we incorporate machines? Whenever you are in times of disruption, such as now, because we are in terms of disruption, not because of the economic crisis, which we share difficulties with your country as well, but in terms of the technological changes that are happening, I always like to think in terms of other people who have gone through through similar things, right? And I think this guy, Martin Luther King, is a great example. And I'd like to finish my presentation with one idea he said. He said, I have a dream, okay? And that's important. He didn't say I have a business plan, or I have an Excel spreadsheet, or I have calculated my return on investment, right? He didn't say that. He said, I have a dream, okay? So in order to move things forward, we need to have a dream, a desired future that we'd like to have, okay? So I'd like you to have your dream and make a better healthcare for all of us. Thank you very much.